This is our first time using Teams instead of the Zoom platform that we were using previously. So give us some grace if there are technical difficulties today. We do have the Q&A chat, or I'm sorry, the Q&A function enabled, but the chat is not enabled. So if you have questions, please submit them to the Q&A. Today we have two exciting speakers talking about farm workers as a specific population that's impacted by heat and other climate-related factors. Our first speaker is Amanda Blanchet. Amanda is a PA in the emergency medicine residing in Boise, Idaho. She studied international business at George Washington University, then went on to complete her PA studies in Boston. And in 2023, she graduated from the Climate Health Organizing Fellowship with Cambridge Health Alliance. She has lectured internationally on various medical training and education topics. Among her favorites was a customized curriculum for national park rangers in Sri Lanka, teaching emergency medical training for those who protect wilderness and wildlife. Amanda currently serves as the executive director of the Idaho Clinicians for Climate and Health. Amanda, take it away.
All right, can you hear me okay? So let me just share. And can you see this all right? I'm gonna go ahead and get started. Sorry, I just don't have any feedback to make sure you guys can see and hear me, but we'll get started. I'm sure you'll interrupt if you can't. So today we're going to talk a bit about farming and climate change. I'm really excited to have Irene here with us as well, since she does work locally and has some really practical applications and experience to speak about after I talk a little bit about some of the health implications that we're seeing in a changing environment. And so Ethan already mentioned, I work in the ER here. I do see some of this in person, but I'm going to be focusing a bit more on kind of the outside the hospital environment. It goes without saying, but I'm going to say it anyway. Farming is the backbone of the state. It's the backbone of this country. And so all of us are reliant on our agriculture systems, our farm workers, and we need them to be protected and cared for because they are an integral part of raising food. And historically, as we'll talk about, there's been a lot of problems with their labor rights and specifically affecting their health. And we're seeing it worsen as the climate worsens. A lot of what I'll talk about today focuses on farm workers, but it can be extrapolated to any occupation with environmental exposures like farm working, landscaping, fishing and hunting. And then we often think of environmental exposures as outside, but your environment is just where you're living, where you're working. And so that can also apply to baking or boiler operations or mining, anything in which there's heat or oftentimes air quality compromised. So I feel like this has become a popular visual, but I like to include it for those of you who haven't seen it. This is climate disasters as by billion-dollar disasters. And if you're being a critical thinker, yes, it is adjusted for the consumer price index. It's not just that things have gotten more expensive, but we're actually seeing an increased number of these severe weather events year over year. So we're going to focus a bit on extreme heat. What is extreme heat? It's actually defined in a few different ways depending on who you listen to. So the CDC and EPA are refer to it as weather that is much hotter than the average for a particular time and place. FEMA refers to extreme heat as high heat and humidity greater than 90 degrees for at least 2 or 3 days. And NOAA refers to it as hot or dangerous temperatures that is seen to negatively impact people and animals and the environment. One thing I'll mention is you might hear the term heat index, and that is including how the heat feels, usually because of humidity or reflective heat. And so that's why on some days we'll feel numbers, the number you're looking at and see feels actually quite different. And other days the same temperature is actually much more tolerable. So one thing that we're seeing is that each year is getting hotter and hotter. 15 of the past 16 hottest years on record have been since 1998. In this graph, all the way to the left, you're seeing 91 to 2010. Already, when you're dealing with greater than 50 days above 100, like it is in the Southwest, that's becoming intolerable, especially when that extrapolates out to multiple days above 90 degrees beyond that. And so when you look forward just a generation or two, we're really going to have to figure out how to address this, looking at extreme heat in a large portion of the year over a large portion of our country. Another thing I'll mention is we're also seeing a rise in nighttime temperatures, and all of this has implications for our health, as I'll get to. I'll also mention that it's not just the number of days, but it's the duration, the frequency, and the intensity that we're seeing go up steadily each year over year. Yeah, I'll just leave that at that. So when we're focusing on farm workers, we've seen a lot of environmental heat increase, but they're generating heat from within. They're moving upwards of 7, 8, 9, 10 hours a day, oftentimes without breaks. And I think for me, I'm in an air-conditioned environment when I'm working. I have a lot of time to sit or drink water. I think it's hard to remember, even if you go on a 1-hour hike in 90-degree weather, it's exhausting, even if you're hydrating, even if you're going slow. And so when we're thinking about the Treasure Valley and Idaho broadly, we're seeing a number of hot days. These workers are working hours at a time, and they're generating internal heat. There's this kind of trifecta of the external environment getting hotter, working and generating internal heat, and then insufficient labor protections that's showing now over the past couple of decades, just irrefutable data of the number of injuries we're seeing. U.S. crop workers are 20 times more likely to die from heat stress than the average civilian worker. And a recent Florida study that I read showed that 50% of farm workers were found on a daily, just randomized test. Up to 50% were found to have a core body temperature of above 100.4 at random times. So this leads to kind of one of the first things I'll talk about now that we've covered that background is we're seeing one problem is heat stroke and heat exhaustion. This kind of lives on a bit of like a scale. So you'll see some mild symptoms with heat illness where there's cramping and rashes and nausea. And if it's not addressed, if people aren't cooling down, drinking water, or resting, that's where it can lead to heat stroke. There's technically some semantics around whether it's exertional or not, but functionally it's very similar in the body. The results that when you get to heat stroke, you're essentially adding the component of organ damage or mental status changes like confusion or fainting or even seizure. This is a problem. There's been some really sad events where farmers have been demonstrating confusion because of this, and managers or supervisors have thought they've been on drugs or haven't taken it seriously, and they've died because of it. So another consideration, for those of us who are local, we've felt the effects of wildfire smoke. We see it, and for those of us who can control it, we're told not to go outside, not to recreate, and to wear masks. And the problem for a lot of agriculture is that they don't have the ability to take the breaks. They don't have they don't make money if they're taking breaks. So that goes both for taking a day off, and then also there is a payment structure that's pay per piece, and that really is incentivizing constant working and the ability to avoid intaking this smoke and these high particle harmful respiratory particles. So I'll mention also that, in Idaho, I think, so just in 2024, last year, we saw over half our days in July were unhealthy for sensitive groups. And so many of you may be familiar with this air quality index way of measuring. And when we get above 100, it's unhealthy for sensitive groups. It's also unhealthy. And this is just for resting outside. And so when you get into exertional work, when you're breathing in even more and taking in more, that's really not ideal. And when we're looking at half the days per July, which is, high season, it's very unhealthy. So some of the effects we see from this, they start from mild, from runny nose to itching, burning eyes and cough, and really can worsen to severe lung infection. Cardiovascular outcomes like stroke and heart attack increase because of the inflammation and the stress on the body from taking in these particles. And then, there's populations like asthmatics and those with COPD who are a much higher risk. And there's other populations that you might not even think of, like pregnant women or problems with preterm labor, low birth rates that we see. So, there are young men, there are older men, there are young women, there are pregnant women, all working in these environments, all being affected in different ways. The last thing I'll mention about wildfire smoke, is the World Health Organization deemed air pollution as the greatest environmental health risk in 2019, seen as a silent killer, because oftentimes it's not the obvious direct cause of death, like in the cases of strokes or heart attacks or pneumonia, but it is one of the greatest risk factors leading to that. So in 2019, air pollution was the fourth leading cause of avoidable death in the world. So we've covered heat, wildfire smoke. Another environmental exposure that farm workers are experiencing are pesticides and chemicals. This paper you see on the left, Irene collaborated on with some researchers from Berkeley and BSU, and this work was done locally, looking at farm workers in Southwest Idaho and pesticide exposures. And this chart you'll see here, they specifically looked at urine concentrations of several different commonly used pesticides. Probably the most common, which some of us may have heard, is glyphosate, which is an herbicide. And every single one of the 60 farmers tested had at least one of these pesticides present in their urine. So acute pesticide poisoning, typically we're seeing that within 48 hours of exposure to high levels of pesticides. See things like dizziness, nausea, vomiting, and headaches. That's a little bit more rare, but it happens. But I think where a lot of the concerns are with pesticides is how little information there is up to this point on the health impacts of the various chemicals used and the long-term effects. Fortunately, there is more and more research coming out and more data. This is just some of the headlines. I did read through all these papers. They are statistically significant when we're looking at things like end-stage renal disease, arthritis, even rates of cancer, respiratory problems from various pesticide chemicals. One thing that I'll mention too is a lot of the exposures are highly underreported. So because it's kind of the norm in the field, a lot of farm workers kind of just see it as part of the job. Occasionally, they're encouraged to wear PPE, like masks and gloves, but oftentimes too, they'll be spraying just at the adjacent farm that they'll be downwind from. And so it can be really difficult to avoid. One study that was really compelling was that more than one medical visit due to pesticide use and a hospitalization was significantly associated with end-stage renal disease. And I'll spend a minute talking about that next because kidney disease is one of the biggest problems facing farmers. So there's this term called Mesoamerican nephropathy, and it's kind of changed over it. There's been a lot of trying to define it. So then it became chronic kidney disease of unknown cause, and then of non-traditional cause. Essentially, this started because in Central and South America, there was increased rates of kidney disease and kidney failure in non-typical populations. So we're oftentimes seeing kidney problems in diabetics or for genetic or other infectious reasons or high blood pressure. These people who are getting this kidney disease did not have any of the classic risk factors. What was being noticed was that, since this Mesoamerican nephropathy was first kind of diagnosed, over 20,000 people in Central America have died because of it. And it sort of evolved and changed its name because similar diagnoses and populations were being found in the Middle East, places like Nepal, Bhutan, a lot of places where there's high heat stress from occupations. So after, learning a lot about this, I have a feeling it's going to change its name again because it's not really unknown anymore. It might be non-traditional, but we're seeing like clear patterns of why it's caused. And it's caused because of high heat stress, body stress and overexertion and dehydration. And it's kind of these factors that all come together to create this recipe for disaster. The study on the right, which by the way, La Isla Network, I'll reference them a few times more here, but they've just done incredible work and high quality research to look into these problems. This study specifically was, there's been rates of kidney injury, but this study specifically showed that evidence of acute kidney injury leading to the long-term functional decline of kidneys, which had been not exactly validated previously, but we are seeing now that even these episodic kidney injuries are leading to the chronic kidney decline. This was a really great article in Time. I liked this quote a lot, that chronic kidney disease is poised to become the black lung, quote unquote, of climate change. So, around the globe, we're seeing kidney disease pop up for non-traditional reasons. In many ways, we're still worried about lungs from wildfire smoke and this and that. But when we think about those exposures, the tiny particles that you're inhaling, they actually end up in your bloodstream, and then that's filtered through the kidneys. So, whether it's heat and exertion, dehydration, wildfire smoke itself, all of these things are leading to poor kidney function. I liked this graph because it kind of puts it together. And so when we're thinking about kidney disease of non-traditional causes, these workers are young. They don't have diabetes or hypertension, although some workers do, and that puts them at even higher risk. But they lack those common risk factors. And then the combination of work and intensity of work without rest and without hydrating is causing kidney injury and kidney failure. This was a pretty amazing study that La Isla Network did specifically on sugarcane workers in Nicaragua. I'm going to get a little bit into some of the solutions while we're talking about the problem with kidneys, but they implemented what they called like a heat protocol where they had, and this one was really well done. This was done with rest, shade, and water, and that included stopping work at noon and regular breaks, and then having a movable shade tent and water and electrolyte solutions, as well as these kind of complementary health assessments and training for supervisors and farm workers, and then monitoring everything really well. And what they saw was that through keeping the core body temperature down by implementing these rest protocols, the incident of kidney injury went from 21% to 1%, which is absolutely drastic and radical. This is important research for the quality of life and the health for these farm workers. It's also, and this is like where the beauty of a lot of this, these conversations around climate change and solutions come in, like the number of co-benefits is dramatic. So this was a really remarkable result from implementing these rest periods. We saw that the productivity actually went up so dramatically that they would work less hours and aggregate have more tons at the end of the day of the crop that they were harvesting. So, some of the recommendations are, above 80 degrees or so, having a 5 to 10 minute rest in shade with hydrating 8 ounces of water or electrolyte solutions every 30 minutes above a certain threshold. And I think a lot of us, if we were just working outside in the heat for that long, would be doing things like that. We wouldn't be going 3-4 hours without rest or without hydrating. And so this is where, I think Irene will talk a little bit more about what we're kind of doing locally and what we hope locally to protect these farm workers. But, short of labor recommendations, right now OSHA has labor recommendations, but there's no federal mandates. California, Washington, and Oregon have state mandates, but we don't. But apart from legislation, the people who are running the farms, managing the farms, should be incentivized to have their workers rest, because it's dramatically increasing productivity, not just productivity, but return on investment. One study also done by La Isla Network showed that the total daily productivity was up to 10 to 20%, and then their return on investment 21%. So that's pretty dramatic, and just even another reason that we should be protecting these people and focusing on their health and longevity. Another thing I'll mention is these. So what we're talking about implementing, this rest water shade, it's about like $100 per year per farmer that we're looking at. It's really minimal investment. And so one of the recommendations is to have a movable tent so that they can always be 75 meters or so from rest. These are lightweight structures, always having some sort of water source, ideally an electrolyte source too, and then having emergency availability to cool down. So when we're looking at things like heat stroke, heat exhaustion, we want to cool the body temperature as quickly as possible without shivering. And so that can be, hydrating when we're talking about field outside of the hospital setting, evaporative cooling with fans and spray bottles. They now have these cool vests that you can put on that circulate cooling water. There's several options, but really these interventions are super, super simple. That's just allowing the body enough time to cool down, hydrate, and rest. Additional solutions, immediately we talked about wildfire smoke, and there are some problems with PPE. So yes, ideally everyone should have access to N95s, but there's also the issue of it being really hard to breathe through them and feeling out of breath and feeling sweaty, and the PPE being uncomfortable with pesticides or wildfires. The rest in heat protocols are kind of the most important intervention, but also sun protection and breathable fabrics. A really, I think an important one that should be used more is adjusting working hours. And so we think of these traditional labor times of 8 to 4, 9 to 5, and if they can adjust their working hours to be from say 5 a.m. to 10 a.m. and then if there can even be another shift from say 4 or 5 p.m. into the evening when it starts to cool down, that can be super helpful as well. And then I spoke a bit about how there's really no national labor standards, there's recommendations, and so yeah, farmer protections would be ideal. I would love to see us move in that direction, but short of doing it, seeing that there is benefit to the farm itself and the people, I hope can be helpful. And then also, Irene will talk a little bit more about what her organization is doing locally, and hopefully many of us can feel encouraged to support what they're doing. I'll just say lastly, I've been working with Idaho clinicians for climate and health for the past 2-3 years. And it brings us a lot of joy to share this information, to try to help our community, to try to see Idaho remain healthy for years to come, especially in a changing climate. So feel free to reach out to us. That's our email and our website. If you're not a member, it's $50 a year and it goes a really long way to support what we're doing. You can become a member. And I'll just end with this quote by Margaret Mead: that is never a doubt a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So thank you.
Bravo, Amanda. Well said, and a really interesting dive into the health impacts that we're seeing in the farm working community. Irene Ruiz is our next speaker, and she's the daughter of Mexican immigrants, grew up in Hazleton, Idaho, where she also worked the fields with her family. Irene received her Master's of Arts in Hispanic Studies at the University of Illinois, Chicago, and her Bachelor of Arts in Spanish from Boise State University, and currently lives in Boise. Irene has been an activist for over 20 years, currently working with the Idaho Organization of Resource Councils. She's a board member for the ACLU of Idaho and the Stay at School Quinceañera program and the Indigenous Idaho Alliance. Irene also co-founded and organized a coalition to support the Latinx, immigrant, and farm working communities called the Idaho Immigrant Resource Alliance that started in 2020 to support those communities around climate change. IIRA won 2022 Humanitarian of the Year Award from the Idaho Commission on Hispanic Affairs for their work. Thank you, Irene, for joining us today.
Thank you. Share my screen. Can you see?
Yes, we can.
Okay, cool. So my name is Irene Ruiz. I'm Executive Director of the Idaho Organization of Resource Councils. We are a grassroots organization. We focus on, grassroots issues to support our communities. So we work down, up instead of top, bottom. So that's a little bit of who we are. We've been around since like 2014, so about 11 years will be this year that we've been around. So I'll talk a little bit about climate change and farm workers and kind of the advocacy part of it. I think people don't realize that there's a group out there that's actually advocating for farm workers who are dealing with the change in climate. And we're the only group in Idaho doing that right now. There's other states like Florida, Washington, Oregon, California, other states that are doing some work around this same issue. So I'll start with a quote: "Every time we sit at a table at night or in the morning to enjoy the fruits and grain and vegetables from our good earth, remember that they come from the work of men, women, and children who have been exploited for generations." And that's Cesar Chavez, who was a farm laborer back in the day and did a lot for farm workers' rights and unionizing for them. Let's see if I can, don't know why it's not going. There we go. This is different, so I have to get used to it. Connection. I think it's important to talk about farm workers and their connection to the land. A lot of times farm workers do come from, places in the origins of countries where they've worked a lot of their land. Like my family, we've done we've worked from the land. That's our people are from the land. My grandpa has worked in the land. My dad, all my ancestors have worked in the land. So for us to be farm workers when we come to the United States, it's natural for us just because we really care for the land, and the land is important, and we know that the land gives us what we need to sustain ourselves. So the organizational work to support farm workers, IORC is what we call our resource council. So we are the hub of these two entities. Visión2C Resource Council, which was founded in 2019 by folks in Canyon County. It is a Latine led chapter, and they focus on, right now they were focusing on farm worker issues, but in 2019, I don't know if you heard, but like a dozen farm workers in Parma got sick from pesticides next to an onion field, and so that was one of the issues that this chapter wanted to work on, was how do we support these farm workers with pesticide poisoning, right? Because there's not a lot of resources to be able to do that. So that was kind of our first ever campaign for Visión2C, and we actually worked on legislation to stop Pilot Association from, not being held accountable for spray in case it happens. We were able to do some rulemaking allowing a definition of pesticide drift, and also including Spanish with, when it comes to pesticides. So Visión2C is that chapter in Canyon County, and then Idaho Immigrant Resource Alliance, which we call IDA for short, it's our service-based arm actually, and it actually started during the pandemic. A group of us got together and decided, okay, we need to support the immigrant farm working in Latinx community, because we knew that with the pandemic, people were going to have a hard time getting resources and things like that. So that's why IDA started, because it's to support folks who need that help, that might not get it in other ways. So there's different projects we're working on, and I'll go through each of these projects that we are doing at this point. And so our goal is just to make sure that every project that we're doing, we're advocating for farm workers and climate change, and also not just that, but also their health and their safety, and ensuring that they're getting their needs met. So IDA support for farm workers. In the past, we have done food boxes. We tend to get organic cultural foods. I mean, you can go to the food bank and do what, to get food, but a lot of times folks, especially folks in Latin America, they want to eat their cultural foods, right? So what we did is we created a box that allowed them to have their food, like nopales, like cactus, beans, cilantro, peppers, things like that they would use. And we thought that was important. So we made sure we gave them what they needed. We also created a billboard thanking our farm workers. I think a lot of times people see farm workers as the invisible workforce because they are in the rural areas. And also a lot of times we see that farm workers they tend to be hidden, right? And so we decided to do a billboard, and we had a lot of people so happy that we did that. It was in Nampa, by the Winco, in that area right there in Nampa. And so people were like, oh my gosh, they see us, and I think we make this assumption because we might think some people are undocumented or not, that they don't want us to see them, but they do, because they're the ones that put food on our tables. So it's important that we recognize them for all the labor that they're doing for us. We gave out hand sanitizer. If you remember back in the pandemic, we ran out of hand sanitizer, so we ended up getting from distilleries. So we were able to give out hand sanitizer and masks to the farm workers to prevent from COVID. And then also gloves for hop workers. When you string hops, it tends to have chemicals on it still. So when you're stringing them, you can literally burn your hands. So there's specialty gloves that hop workers use to protect themselves from that. So we've been able to do that as well. One of our biggest projects that we've done, and this will be our 5th year, is the JJ Saldana Heat and Smoke Fund. It is a fund, it's like a crowdfunding mutual aid fund that we have every year, that started in 2021 to support farm workers through heat and smoke. And the reason why it was started, because I don't know if you remember, in 2021, we had a farm worker in Washington and Oregon die from heat exhaustion. So the group got together and we decided, hey, we need to do something. We need to give supplies, because I don't know if you all know, but a lot of the times these supplies, the farm workers need to buy them themselves. They're, contractors who they contract with, or maybe the farm owners may not be able to give it to them. But our goal is to provide these resources so they don't have to take money out of the pocket. That way, that money that they're making is going towards their families, or for them to be able to sustain themselves. And so we've raised about every year we've raised about $10,000 to $15,000. We get like hundreds of items donated. And so we go around Treasure Valley, Magic Valley, and we've done Northern Idaho. We've also done Southern Idaho, really South Idaho. So these farm workers are like so grateful that, you know, they see us and that we're giving out these supplies. And our goal is just to make sure that they're safe, right? And making sure that they're getting sunscreen, hats, electrolyte packets, water, Gatorade, you know, anything that cooling pads, coolers, anything that they need to be able to like protect themselves from the heat and the smoke, and masks too. But sometimes I think people don't realize that sometimes PPE, which is, you know, protection equipment, can be kind of hard sometimes because it can get hot, especially when it's hot. But also people need to realize that you have to protect yourself from the elements, because you can, you know, smoke can give you asthma, and heat is just, you know, you just need to protect yourself with sun and making sure you're covering your body. Because when I worked in the fields, we had to cover everything, right? We wore plaid shirts, pants, hats. We were covered, gloves, because we had to protect our skin from the sun. And also we would wear bandanas for the smoke, but bandanas are not the best way to protect yourself from smoke. N95s are probably the best way to do that. So we have this Farm Worker Health and Justice campaign, which is a statewide campaign that we're using at IORC to support, educate, and create policy to protect farm workers from heat, smoke, and pesticide. So, you know, we're going to do advocacy, of course. We have a storytelling project, educating folks and organizing those communities, along with health. You know, we want to work with health professionals to help us, like, you know, if we need to go out there to do classes on how to protect yourself from heat, smoke, and pesticides. And also, not only that, just being able to like get a mobile clinic out there. So any other health questions or issues that our farm workers have, they can ask those professionals. We've done research, as Amanda mentioned, we've done research with Boise State Public Health around pesticides. We did a little bit about with heat, and hopefully we're working with a couple of universities around smoke in Idaho, how smoke inhalation is bad in Idaho. And then policy, we work on local, state, and federal policy that includes the pesticides that we're talking about. This year we worked on pesticide immunity bill. It's a bill that our big pesticide producers wanted to put in our legislature in Idaho to ensure that they're immune from any type of lawsuits for the pesticides that they use. And we were able to fend that off for the second year in a row. So we got lucky there. But also because a lot of our farm workers are immigrants, a lot of them have mixed status, either they're documented, undocumented or not. We're tackling immigration rights at this point now, because we have to do that. That's one way to protect them. And I just want people to understand, when you do climate justice work, it's all intersectional. So all these justices that we talk about are all related to each other. So our farm worker storytelling project, we actually are trying to create a film on this. And also we're going to go out and collect more stories and create like a narrative. We want to shift the narratives of what farm workers are. We want people to see that farm workers are human. We want to humanize the voices of those who are directly affected through farm work. And we just want to make sure that people are seen and not seen as commodities, not seen as just, oh, you're going to, you know, make all this money for me. And we just want to change the narrative where there are people who are being affected by climate change, people are being affected by the current immigration climate, anti-immigrant climate we're seeing. So our goal for this project is not just to have a film, but also like a whole like storytelling narrative project, right? It's not going to, we want it to be like a compelling story, not like my name's Maria, I came from Mexico. We want to like tell a real great like story on these farm workers. So I'll give you a little bit of the quotes that we've gotten last couple summers ago around climate change and what they've been seeing. And take note that some of the people that we interviewed have done this work for 20 years. So they have seen a huge shift in the climate. And of course they would know, right? If you've been working for 20 years, you're gonna know the climate has shifted. And they've also mentioned that work is changing a lot too. The way they're working is changing because either they can't be out there that late, or they have to go in the morning, or they can't work at certain times because of the climate. And so their work is not only just changing, and that not only does that change, if they work less, they make less. They're not paid hourly. They don't get vacation. They don't get health benefits. They don't get any type of benefits, right? So when they're not working out there, their families they're not being able to feed their families. They don't get paid. So I'll give a couple quotes here of the people that we've collected. The usual schedule for seasons has changed so much, where people start working earlier, start working later. People are having a hard time adjusting to what these changes in seasons are because of the changes in climate. we've seen that there are a lot more wildfires. We've seen that it's been getting hotter, that the heat is lasting longer throughout the day. And that's what's challenging, because there's already no rules or standards set in place to protect farm workers. So they already see this. They see that they're not being taken care of. They're seeing that they feel like people don't care about who they are and the work that they do. So they're very self-aware that they know that there's a lot of work to do, and that having groups like ours being able out there to help them advocate for themselves is super crucial. The next one is, I've seen it in the amount of just how hot it is every year and how it doesn't die down. It's like 9 and it's still pretty much hot out there, and you're like barely getting home from work at night when you're trying to sleep. You've been in the heat all day long, and then at night you're trying to cool down and it's still very hot. So people's bodies are not regulating the way it should, right? Because they've been out in that heat. So not only are they they leave the heat, but that heat or whatever change they're seeing follows them home at night too. So hopefully we're going to get more of these stories, and we're going to be able to just like kind of showcase more of how farm workers are dealing with the changes in climate. One thing that some of our organizers have done is the School of Political Leadership, and it's a program by Heal Food Alliance. They're an ag and food national organization, and the goal of this School of Political Leadership is a 6-month political leadership program that helps us, cater our campaigns and helps us advocate for those who we are working for in the food system and for farm justice. And they help us kind of frame what policies and how we want to make our policies work to make them a little bit better, a little bit more easier to kind of like understand and pass. And so they help us create a blueprint for inclusive and democratic food and farm system. And so we want to make sure this is probably one of the best trainings I've ever had in my years of organizing. I really learned a lot, and I think it's helped me understand how policy and advocacy work hand in hand together, because they should. That's important. And so it's for us to be able to have the opportunity to do this with the Farm Worker Health and Justice Campaign was a great way to continue doing great work there. And we actually went to Washington, D.C. to lobby for better conditions for farm workers. We got to speak to our Idaho senators. Of course, we didn't speak to them. We spoke to their staff, but we were able to speak to them, and we want to include better health and safety conditions for farm workers in the Farm Bill. As you know, I don't even know what movie we're going to see in the Farm Bill, to be honest with you. It's been put on pause. It's way overdue with everything going on. I don't know if we'll even see a Farm Bill in the next year or two. But our goal is to include farm workers within that and adding climate change within the Farm Bill, because climate change is affecting our U.S. farming system, our ag system. So we should be including climate change in that. And one thing we did a couple of years ago, we created La Cosecha with Woodland Empire. It was an IPA beer. We were able to sell that. We raised money, and we were able to buy gloves for farm workers, and we just wanted to thank them. And Bobby Gaitan, who also a former farm worker, he's a local artist here in Treasure Valley, created that logo for us. And we were able to buy hundreds and hundreds of gloves for our farm workers through that. And it's things like this, like partnerships, right? Our goal for this was to educate people. These are our hops. There's a little QR code in the back telling people how hops are picked. This is how hops work. This is how it is. Farm workers are out there. You're drinking your beer because of farm workers. So it was a great project that we were able to do to keep providing that education and having people understand that farm workers are giving us their fruit of their labors. So looking towards the future for IORC, we want to add state legislation for mandated breaks for outdoor workers. The 101s we've done with farm workers, that's what they want. There's no mandated breaks in Idaho. That's what we want. As Amanda mentioned, our neighbors up to the north, they have heat and smoke standards, both, which are the most, I think Oregon and Washington are the strictest in the whole country. I actually helped them work a little bit with that in a group when they were working on that. And so I don't know how this will work, but we're going to try our hardest because this is what farm workers want. And like Amanda mentioned, the more breaks they get, the more rest, the better production happens, and the happier people are going to be. We were working on federal heat regulation through OSHA. We actually started a campaign, and we had about 80 or so people send in comments during the comment period for OSHA, but that has been stalled with a new presidential administration. I don't know if that's going to continue or not, but I think we're going to still try to push federally to see what we can do. And again, prioritizing farm workers' health and safety in the Farm Bill. We're going to continue working with that and talking to our legislators in Idaho and, you know, about how important it is to protect them. A lot of our legislators in Idaho, they're farm owners. They work in farms. And I would hope they would understand how important it is to like support farm workers. And if you need any questions, you feel free to contact me. Here's my information, or you can go on our website. We're on Facebook, Instagram, TikTok for EDA, and then LinkedIn and then Threads. So mostly Facebook and Instagram is where you put more I can't talk information now, but you can get a hold of us and the things that we do. And one thing I didn't plug in is that we are going to start the 5th annual JJ Saldana Heat and Smoke Fund. We're going to start a Give Butter link and just be looking out for that if you want to donate or you want to get some supplies out. We're going to be starting that here soon. So thank you.
Thank you so much, Irene. Really fascinating look at kind of what's been done and what people are experiencing working to bring us our food to the table. You know, it really is kind of mind-blowing to think about when I choose to not go for a bike ride because it's too hot and smoky outside. You know, there are people out there that don't have the opportunity to make that decision because they're at work and they're going to be at work. And I just wonder if there's been studies that you're aware of that look at people's like core body temperatures during those hot days as a measure of how people are directly being impacted by this.
I know there were some doing it. I think in Florida they were doing that. There should be studies out in Florida because they were working on that. We were actually going to work with someone from Colombia to do it in Idaho, but that just kind of fell through. We didn't have the capacity. And also, you know, that's kind of when all the federal funding freezes started. That's something I didn't mention either, is the fact that all this research, we don't know if we're going to get enough research out because of the federal funding freezes. And people need to kind of be aware of that groups like ours work with places like BSU, University of Washington, other places to get, you know, these research projects done, so that way we have more information around how climate change and it's affecting farm workers. So we really need to look at how federal funding can affect a lot of the research that's going to happen in the future for the work that we're doing.
Yeah, it does seem like when we have data to stand on, it makes it easier to make these arguments. But Idaho, as we have learned in starting ICCH and working with St. Luke's on our sustainability efforts, Idaho is a big black hole of absence of research. Michael asked a question about this, like, are we even tracking number of extreme heat related visits to the emergency departments? And the challenge that we've seen on that is like, A, the data hasn't really been that available, but we're working on making that the case. But B, we don't identify heat related illness by diagnostic codes. And so if you don't identify it as a diagnosis, then it's really hard to track because the ways we comb through data don't allow us to look at the specific wording about things. So physicians and other medical providers need to be able to amend the diagnostic code manual, which is called the ICD-10, to allow it to identify more things like heat-related illness and smoke-related illness, of which there are some right now, but it's mostly tailored towards, you know, the high schooler who is playing football and got heat exhaustion, as opposed to the myriad causes of heat on our health. This would be a question for both of you. Are you aware of a movement to start this heat and safety standard for indoor and outdoor workers in Idaho, akin to what was done in Nevada recently? And if so, how can clinicians support that type of work?
I mean, I think Irene and her organization is probably doing the most in the state right now. I know that and I'll let you speak to this more, Irene, but you've mentioned wanting to do more surveying and more filming. And I think if, you know, the clinician voice is really helpful in a lot of these issues. And so, yeah, I don't know, Irene, if you want to make a plug. I know you were looking for some folks to be involved in the film and to help with some of the surveys.
I think,
and as well as the drive is really important. I think
as an advocacy group, you know, our goal is to like try to help shift policy with a lot of these things. And so, like I mentioned, we try to like get comments out for the federal OSHA heat standards, but as you know, the new administration shut that down. So we don't know what's going to happen in that front. So then we have to look statewide. What can we do? Idaho will be a little difficult, but we're going to do the best that we can to kind of get policy going to protect farm workers from that. One thing that Washington and Oregon does really well is that they have these promotoras, health promotoras. I don't know if that's what we call it, promoters here, where these, you have like nurses and stuff like that, taking things out to farm workers, talking to farm workers, but also working with advocacy or like organizations like ours to be able to work together in tandem to get supplies out and and get information now. So I would I would love to start something like that in Idaho where we can all get together and just like have our own promotoras to go out there talking to farm workers. And some of them are doing them right, but I feel like there needs to be a more concrete kind of program like the way I see in Washington, how they do it. But there's ways that I think advocacy and health can work together to provide the help that we need for our folks.
And I think I'll just add, I think there's space for more collaboration between our two groups on that front. And I know like Dr. Nakachia works in a lot of community health space through St. Luke's, but also with farm workers. So if anyone is specifically interested in this work, reach out to me as well and we can connect.
Do you know if we have seen any modifications in working conditions since the climate has changed and we've seen these longer periods of more extreme heat and wildfire smoke? Like, are you seeing earlier start times or overnight shift work in the fields like we've seen reported it coming from California, where they're actively considering kind of a night shift crop collection because it's so hot and so dry and so smoky? Like, has that actually come into practice at all in Idaho?
Some places they're just starting earlier, especially if they know it's going to be 100 and something. They'll start really early in the morning. Some people are using headlamps because it's still dark right before dawn. So some of that's happening, but the thing is, like, we don't know. It's hard to track because when you try to talk to people, some people are mum about it, and like we also at IRC we have to be careful with the relationships that we have created, because we don't need, we don't want farmers to feel like you can't talk to them, and so our goal is to make sure we're having these relationships with not only the farmers but farm owners to see what safety precautions they're taking, if they're allowing their farm workers to start early, if they're what are they doing around smoke, are you providing, because they're supposed to provide water regardless of, no matter what, water has to be provided. And hand soap and water should also be provided regardless of. That's a regulation in Idaho that has to be provided no matter what. So
is that happening always?
Not always, but there's not enough people at the Department of Labor to go and see if it's all
check
happening.
Right.
Yeah.
I mean, you just think, again, I just keep going back to thinking about how intense that must be, because the heat and the smoke go together. So you're dealing with those twin worst climatic impacts on our environment at the same time for the majority of the harvest season. And you can't get out there and wear a mask because it's so hot. So you can't protect your lungs from the smoke because then you're exacerbating the heat. And it just seems like this is sort of a completely a group of people that are just being sort of exposed to the worst of the worst without any real protections. And I wonder, are there ways we can identify farms that are treating their workers better, where we can say, we want to preferentially purchase fruits and vegetables from this farm because we know they have good working conditions? Is there any sort of information available for consumers to help drive those kind of better purchasing practices?
I mean, I know there's like a lot of like, oh God, what's that? I can't remember what that group is, but they started not that long ago and they have good information on their website on what good practices are. They work a lot with the farmers market. I can't remember what they're called. Oh, how did I space them? But they're kind of like a newer group. There's information all over the place too on what are the best practices. A lot of times it's just word of mouth, especially if we go to farm workers. We just like, hey, you should be eating, more watery fruit, right? They'll keep you hydrated and things like that. Don't drink soda. Sometimes we'll get people, some of our volunteers will be like, hey, they donated a bunch of soda. I'm like, yeah, that's not the best thing for them. That's something they should take home and have later when they're outside in the heat. So
I'll add to that, just inherently regenerative farming practices are going to be safer environments for farmers to work in. And so if you know that you're purchasing food from a regenerative organic farm, there's oftentimes layers of shade and, you know, they're not using high levels of pesticides. You asked about like changes with the heat and environment. Irene and I were talking before about how there's actually a need for higher levels of pesticide spraying in the heat because of the evaporation. And so when you know that you're purchasing from a farm that is prioritizing low pesticide use, there's shade on there. And oftentimes with those smaller farms too, there's just more intimacy. And so there's better labor practices, and there's better soil, which could be its own whole lecture about how important keeping good soil is for everyone on the planet's health and safety. So yeah, I would say focusing on local regenerative organic farming practices.
Yeah, a lot of folks are working on that right now. I know we did a little bit of that. We did some corn like a couple of years ago. We made masa out of that, and organic masa. We were able to sell it and get, you know, proceeds. So it's a way to educate folks too. It's like, hey, these are ways to be sustainable. These are ways to eat good food, healthy food. You know, you're making masa out of organic corn instead of like corn that has all these other different things. So we've tried to like delve into as much as we can around this, but you know, our focus right now is just, this is what we're going to do. We're going to support farm workers, get them what they need, and do what they're asking us to do, because they're the ones that are out there, right? So it's important to listen to them and what they want, and not us making assumptions. Oh, this is what they want. We don't, you know, that's why we always have these relationships with them in the conversations.
Right. We've seen that kind of with wildland firefighters, with efforts to offer more protection for their environmental exposures, that, you know, initially there were some efforts that weren't led by or designed or involving people that were working in the field. And so they were presented with these options that were just not compatible with their actual work. So they didn't get utilized. And then it became this thing where, you know, it was a burdensome regulation that was being forced on them instead of an opportunity to protect your health. So I think it's really crucial that as we start looking at how to make these adjustments, that the voice of the people that are in the farm doing the work are right at the top of the list of people that are involved. Just time for maybe one or two more quick questions. Do you know, Irene, are we able to identify how many men and women and how many pregnant people are working in farms in Idaho at the time? And maybe for Amanda, how we can differentiate the impacts of heat and smoke by gender or by pregnancy category? Like, how are we seeing those differences in health impacts, men versus women? So Irene, do you know if we have statistics on how many farm workers there are in Idaho?
The same people we did the pesticide work with, they did another project around farm working women, and so they have those stats there. Sorry, I don't have it on top of my head. I probably should look those up. Usually have that out with me, but they did kind of stats on how many pregnant women are working out, and it's in Idaho, right? Mm-hmm. And you know, there's other places where they're doing research around women who will work in the fields, like are their children being born with different birth defects, or what's going, you know, how are their pregnancies going and things like that. So that research out there, for sure. I just don't have definitive answers right now on that.
And I think your question was how these environmental impacts are affecting different populations differently.
Correct.
I'd say so the biggest difference between men and women would be if the woman is pregnant. When we see, and there's a lot of data about high extreme heat waves and wildfire smoke, let alone working in those environments, that there's low birth weights and preterm labor, which are inherently risk factors for just a myriad of health complications downstream. Even a few hundred grams lower birth rate or a few weeks, we're seeing increased respiratory infections for the babies, increased complications at birth, etc. But I mean, everyone is at risk in different ways. And I think anyone here who is a health worker or a clinician should really be educating any age and any gender about the risks for working in high heat or high smoke environments. You know, you just keep it in the back of your mind for folks you know are landscapers, construction workers, farmers, that really driving home the importance of those rest periods and the hydration, because everyone is affected in terms of wildfire smoke and heat in like a cascade of ways if you're looking at each system: cardiovascular, respiratory, neurologic. Like even we're seeing increased rates of dementia in the older populations with exposure. So it's kind of, a lot of this stuff is not perfectly well understood, but we know that there's increased rates of inflammation, and that just creates this cascade and downstream problems in every population we look at.
Okay, we need to wrap things up, but I really appreciate the insight into this really unique population that is so crucial to our community's health and prosperity, and is in such a unique position where there's this push and pull of have to work with challenging conditions that really makes it so that this population is more vulnerable to significant health impacts. And we as a healthcare community need to stand up and help support them, either through advocacy or through educating ourselves and being more present to care for people that have been really risking their health to put food on our tables. So thank you for both of your interesting presentations. We will be back, I believe, on May 21st with Caleb Dresser from Harvard University talking about heat and impacts on older and younger populations, sort of the two ends of the age spectrum, and how those specific populations are impacted. I think the new format worked out nicely. There's some interesting posts in the chat, in the Q&A section, so please take a look and follow along, and we'll see you next month. Thank you again, Irene and Amanda.
Thank you.